Hi, everyone, and welcome. Today, we will be discussing the Code of Ethics for the nutrition and dietetics profession. As we all know, ethics are a fundamental part of any profession and provides a set of guidelines for how a practitioner and a profession conducts itself. Practitioners are under an obligation to protect patients, their clients, and the profession itself. In this presentation, we will examine a case that presents an ethical issue. In using the Code of Ethics, we will examine the 4 principles and how they are related to this case. We'll also examine what the RDN's role in the situation would be and what the RDN should do. So the situation that we're presented with is an elderly patient with severe dementia wanting to discontinue her tube feedings. She explains to the clinician that she is exhausted from being hooked up to several machines and no longer wants to be fed out of a bag. The daughter understands her mother's frustrations but disagrees and wants the tube to stay in. She fears that with her dementia she'll forget to eat and drink and not receive the food and fluid that she needs. The mom does not have an advance directive. So with the case in mind, let's examine the principles. The 4 principles in the Code of Ethics are non-maleficence, autonomy, beneficence, and justice. Non-maleficence is the intent to not inflict harm. Practitioners should use evidence-based practices and scientific knowledge at all times. They should understand that all patients are unique and present with unique circumstances. They should always stay within the limits of their scope, but collaborate with other healthcare professionals and members of the care team when necessary. Autonomy is the second principle and discusses that patients and clients have the right to engage in decision-making about their own health. Providers do have an obligation, however, to disclose any conflicts of interest and to always adhere to good clinical practices. Providers should maintain a professional environment. They should always respect decisions made by their patients and clients, and that all health information should remain confidential and should be documented truthfully and accurately. Third is beneficence, which talks about balancing the benefits and the risks. Practitioners have an obligation to uphold the well-being of their patients that are receiving their care. All communication should remain constructive and professional, and this is to ensure a safe environment for all. Lastly, justice is the 4th principle and talks about creating a fair environment for all patients to be treated in without bias. Practitioners should be an advocate for nutrition and the profession and should always educate the public on nutrition matters to promote trust within the field. Now, with background on the case and definitions of each principle listed within the Code of Ethics, let's examine how we would respond to the situation and how we can relate each principle to the situation. So if I were the RD, I would start by having a conversation by educating and informing both the patient and the family, in this case the daughter, on what they're asking. We're not here to put our opinion onto them and decide who's right and who's wrong. I would present the facts to the family and who's involved, the patient and her daughter. I would also discuss facts that the family might want to consider. Some of these facts might be, will the overall decision impact the patient's quality of life? Will it benefit the patient? Will it make them happier? Will it make them more or less comfortable? And what are some possible complications and risks? And how serious are they? But ultimately, what we want to talk about is, what does the patient want? After having a conversation with the patient and their family and listening to their wants and concerns, I would then examine the Code of Ethics and how it relates to this situation. So let's revisit those. Non-maleficence, the intent to not inflict harm. We want to ensure that a final decision is ultimately what's best for the patient. Is it the mom's wishes or the daughter's? The mom wants the tube removed, and the daughter wants the tube to stay in. We also have to consider the second principle, autonomy, and determine if the patient is able to make decisions for themselves about their own health. In this case, the patient does not have an advance directive, meaning that she is not given specific instruction on the type of medical treatment that she wants. However, she does clearly state to both her daughter and the clinician that she wants the tube removed, and as the RD, it is our job to listen to her needs. It's also up to us to remain unbiased. And in doing so, I would make sure that both the patient and the daughter feels as though their concerns are clear and heard without telling them who's right and who's wrong. Unless stated by other members of the medical team that this patient does not have the mental capacity to make decisions on her own, that she's able to, and that we should listen. Lastly, to ensure that everyone is treated fairly, it might be advised to consult with other colleagues or members of the care team to ensure that a proper decision is made, all while keeping the patient's wishes a top priority. So, with all of that being said, what should we do? First things first, I would discuss the situation with the clinician that was with the patient and the family at the time. I would take a close look at all the facts we know about this case, all while considering the 4 principles. It's never easy discussing medical matters with family, as there are many opinions and thoughts to how a patient should receive care. But as the RD, I do have to respect the patient's wishes, and in this case, it would be to end the tube feeding. She does have the mental capacity to do so, as it's not been stated that she doesn't. And she clearly stated with the clinician and in front of her daughter that she wants the tube removed, and that should be respected. Now, with that being the decision that I would make based on the principles and the known facts and information given at this time, there's still a huge conversation to have to make sure that everyone is on board and understands the decision that I made. So I would go back and I would talk with the patient and her daughter just to make sure and make clear that they both know the benefits and the risks of the decision. And to help ease the frustrations and concerns of the daughter, I would also explain that there are many alternatives to ensure that her mother receives adequate food and fluids. Some examples of this may include enrolling her mother in assisted living facilities where she can have access to care 24/7. They could hire a home health aide to have someone in her own home where she's comfortable providing care 24/7. If financials are an issue, they could have a family member move in with the patient or having a patient move in with a family member. They could also consider stocking the house with foods that she enjoys and those that are easy to eat. Having the mom walk around her house, looking in her refrigerator and cabinet and seeing foods that she knows she likes, remembers eating, might help her keep up with meals. Leaving notes on cabinets, counters, and the refrigerator on shelves can be a trigger and a reminder for her to eat as well. Meal prepping is always an option, which makes meal times easier. She can take them out of the refrigerator to heat them up and serve them to herself, but also simply just calling over to her during meal times to remind her to eat is a solution as well. Now, as the registered dietitian, this decision was based solely on the facts presented in this case. If other members of the team deemed that this patient was unable to make decisions, or if the risks of removing her tube outweighed the benefits, other outcomes and decisions that we came to might have been different. And that would have provoked a deeper conversation and research with both the patient, the family, and other clinicians that are providing care to this patient. So thank you. I hope you learned a little bit about the code of ethics, the principles, and how we relate them to a specific case. Thank you.